Hello, my name is Rachel Mangus with ICUBA. I just wanted to welcome you to the open enrollment presentation for our 2021-2022 plan year. We hope you find this information useful as you proceed with your enrollments for this upcoming year. This slide is a quick summary of what's new in the upcoming plan year. Please take a few seconds to review these items. We'll spend a lot more time discussing all of the new benefits in this presentation. As I mentioned, I'm Rachel Mangus, and I'll be your host, if you will, throughout this presentation. I will also be joined by a few of our brand partners as we walk through the benefit offerings at your institution. We're really excited to announce the upcoming open enrollment and welcome our 26 member institutions for this 19th annual open enrollment period. We're excited to be celebrating 19 years of service to private Florida education employers just like you, and we're thankful for your continued partnership with ICUBA. Enrolling in your benefits is easy. You just visit ICUBAbenefits.org to complete the open enrollment process. During this open enrollment period, you're free to update your benefits for the April 1st, 2021 through March 31st, 2022 plan year. Your open enrollment elections will remain in effect for the duration of the plan year as stipulated by the IRS Revenue Code. You may only change your benefit elections during the plan year within 30 days of a qualified life event, for instance, if you get married or you have a baby. And then at the end of your enrollment, you can view, email, or print your enrollment confirmation, and Emma is also available to assist you if you have any questions. Dependent verification is also an important part during open enrollment. We know that everybody watching this video reads every bit of the fine print before you click that final I accept button. But in case you missed this paragraph, you are agreeing that all the dependents that you are enrolling in your ICUBA plans are in fact your eligible dependents. Shown on this screen is a list of eligible dependents under the ICUBA insurance coverage. Please make sure that you're enrolling only dependents that meet the qualifications outlined here. An ICUBA fan favorite, our single sign-on section at ICUBAbenefits.org. Just a reminder that you have access to all of your carrier accounts, and these links can take you directly into our brand partner portals. Some of these links may require a registration for the first time access to the link, but the next time you visit the link, you'll be able to single sign on directly into the carrier account that you're accessing. ICUBA wants to keep our members in the know, and we are a self-funded medical plan. So just to explain a little bit about what that means that ICUBA pays all claims processed by the medical, pharmacy, and behavioral health benefit managers using your premium dollars and then money that we have built up in the reserves from past plan years. ICUBA spends these premium dollars exclusively for the benefit of our members, and we create plans specifically designed by educators for educators. You might not know, but we meet with members from each of the institutions monthly in order to make the best plans to fit your needs. ICUBA is really proud that we invest in a long-term culture of well-being so you can be the best version of yourself, and we're really excited to bring a low premium increase for the new plan year. ICUBA spends a lot of time focusing on improving access by eliminating barriers to care. It is really important to be an educated consumer and understand how your plan works before you're sitting in the doctor's office. Our plans are specifically designed to remove barriers to care by providing first dollar benefits on many services, and our comprehensive plans provide full coverage where the deductible only applies to major services.
Your medical election bundles Blue Cross Blue Shield Medical, Optum RX prescription drugs, Aetna Behavioral Health into one medical plan. Additional features of the medical plan include SurgeryPlus, Rally, Hinge Health, My Health Novel, and Aetna's Able To program. ICUBA's whole person approach triggers specialized outreach to members with specific health challenges by trained health advisors, registered nurses, and pharmacists offering support, education, and assistance to help you manage your condition. ICUBA offers very rich, comprehensive benefits to their employees and their families. Many services are covered in full. Examples of these services can be seen in the first column, such as office visits to a total care primary care physician, colonoscopies, both diagnostic and routine, preventive services such as mammograms, PSA testing, and immunizations, including the new COVID-19 immunization, are all covered in full. Other services require that you pay a copay or coinsurance. Examples of these are found in the middle column, such as advanced imaging, chiropractic services, and urgent care visits. Major services require that a deductible be paid. Examples of these services are listed in the column on the far right. Inpatient hospitalizations, surgeries, and x-rays are all examples of services that are subject to the deductible. Blue Cross Blue Shield's My Health Toolkit app can be downloaded from Google Play or the App Store. Once downloaded, you can choose to log in using a username and password or opt using the Touch ID feature instead. When you are logged in, you will be able to download and save a copy of your ID card so that you will have access to it when you are offline. The My Health Toolkit mobile app allows you to view the status of your recent claims or review your benefits. There is also a feature that will allow you to search for participating providers so that you can stay in network and make the most of your benefit plan. Total care providers improve screenings, medication management, and other programs help provide better outcomes and lower costs for patients. ICUBA members enjoy free office visits when seen by a total care family practice, internal medicine, or pediatric provider. Total care providers must meet rigorous quality standards to be part of this special designation of physicians in the Blue Cross Blue Shield network. You can find total care providers when you log in to My Health Toolkit. Now let's switch gears and talk about the details of your plans. The preferred plan is a coinsurance based plan. The plan provides both in and out of network benefits. For the purpose of this presentation, I will be focusing on the left-hand column, which reflects the in-network benefits. It is important that you stay in network whenever possible to maximize your benefit. The preferred plan offers an individual deductible of $2,500 or a family deductible of $5,000. The cost share or coinsurance under this plan is 20%. The out-of-pocket maximum is $4,000 for an individual and $8,000 for a family. This is the maximum amount that you would pay for covered services during the plan year. Please note that the provider office visits are covered with a 20% coinsurance. However, if you choose to see a total care primary care physician, previously known as a BDTC physician or Blue Distinction Total Care physician, the office visit will be covered in full. Lab tests are also covered at 100% when provided by Quest Diagnostic Labs. The Premier Plan is designed to be a copay plan. The Premier Plan offers the same deductible, coinsurance percentage, and out-of-pocket maximums as the Preferred Plan. However, office visits, for example, would be covered by paying a copay rather than coinsurance. Primary care office visits under this plan are covered with a $25 copay. But, as I mentioned earlier, when you choose to see a total care primary care physician, the office visit is covered in full. If you choose to have a virtual visit with a Teladoc provider, your copay would be $5. Visits to specialists are covered with a $50 copay. And as a reminder, under all of the plans, preventive care is covered in full.
Hi, JC from OptumRx. Did you know that prescription drug coverage is included with your selection of an ICUBA medical plan? Preferred generic copays at the NSU pharmacies are $0. Certain diabetic supplies are also free to use, such as meters and lancets. Your coverage has a max out of pocket, so you will never pay more than $2,000 for individual coverage or $4,000 for your family plan. Also, please remember that you can save money by filling 90-day supplies of your maintenance medications. If you have any questions, don't hesitate to contact our customer services teams. Did you know that generic drugs on our preventative drug list are now at a zero copay to you? These medications can help protect against or manage certain conditions by preventing blood clots and reducing a risk for stroke, preventing heart disease and reducing high blood pressure, and preventing osteoporosis. If you have any questions, please contact our advocacy team or an ICUBAcares specialist. You have coverage for prescription and over-the-counter products to help you quit for up to 2 cycles per year at no cost to you. So pick a program and quit today.
Hi, this is Asia Lu, one of the pharmacists with your Pharmacist Advocate team. We work as a liaison between your prescription insurance company, the physician's office, and the dispensing pharmacy. If there's any questions in reference to medications, we're here to help. Any side effect questions, any drug-drug interactions. If you happen to have a new prescription and you would like to know the preferred product versus the non-preferred product, maybe run some test claims and see what your potential co-payments could be. There's also an ICUBAcares rally incentive where we review your medications, and if there is a clinically appropriate and cost-effective recommendation that the member and the prescriber accept, there is a $50 that goes towards your rally portal. If you have any questions in reference to a condition, we can assist with helping you understand it maybe a little more, prevent complications, specifically working with asthma and diabetic conditions at the time. Is there a medication that's excluded that your physician's office would like to proceed with a prior authorization for consideration of coverage of the product? We can assist the physician's office and the member as well with that. Please reach out to call us. We're the toll-free number behind your prescription insurance card, the 1-877-286-3967, or the toll-free number in ICUBA benefits, which is 1-866-377-5102, option 4, Monday through Friday, 9 a.m. to 5 p.m. We'll wait to hear from you. Thank you.
Welcome to your Aetna Employee Assistance Program in Behavioral Health Benefits. My name is Denise Scott, Account Director at Aetna. Your EAP and Behavioral Health Benefits provide a variety of resources and services that are available to you and your family members to take care of your mental health and well-being. Many of us have gone through challenging times and may have experienced increased stress during this pandemic. A crisis or dramatic change often creates a sense of chaos. Our day-to-day normal can all of a sudden feel like it's been turned upside down. The stress of the uncertainty can cause us fear and anxiety, which can be very overwhelming at times or cause strong emotions. Understanding that you're not alone with these feelings, we are here to provide you with support and to get you through these challenging times that you may be facing. We can help you cope with stress in a healthy way, which will make you, the people you care about, and your community stronger. During this time of increased social distancing, people can still maintain social connections and care for their mental health. We can provide you with tools and resources on how to stay connected, adjusting to virtual settings, avoiding isolations, relationship building, activities, and much more. You can speak with a licensed clinician to help you through these difficult times and to manage a diagnosed behavioral health condition. Services can be done over the phone, television, or face-to-face in a provider's office. Nothing should ever stand in the way of your mental health. If you're in need of caring for someone who is, you can turn to us for information, inspiration, and support when you are ready. Whatever you are facing, you're not alone. We are available here for you 24/7 for in-the-moment support. For more information or for support, please contact us at the toll-free number at 1-877-398-5816. Press 1 for Employee Assistance Program and press 2 for Behavioral Health Services. Thank you. Members who are enrolled under ICUBA's group medical plan, preferred PPO, or other plans are eligible for behavioral health benefits through Aetna Behavioral Health. Let's take a look at the variety of services available and member responsibility. If you look at the first category, you'll see Employee Assistance Program, also known as EAP. Aetna's Employee Assistance Program provides up to 6 short-term counseling sessions per episode per year for everyday issues such as stress, relationship issues, grief, and more. This benefit is a free benefit at no cost to you. Aetna's Behavioral Health in-network outpatient services, members on the preferred PPO plan are responsible for a 20% coinsurance, and other plans have a $25 copayment, with the exception of Able2, which is at no cost to you. Let's take a look at the various services under the outpatient category. Professional counseling allows you to speak with a licensed clinician regarding a variety of issues such as anxiety, depression, mood disorders, trauma, grief, substance abuse, and more. Psychiatric consultation and medication management is typically when you see a psychiatrist that can prescribe and monitor medication to help you with your behavioral health diagnosis. Applied behavioral analysis therapy related to an autism spectrum disorder diagnosis does require authorization. You may contact Aetna Behavioral Health and speak with a clinician that specializes in autism who can assist families with addressing questions about your benefits, the authorization process, finding providers, ensuring that the treatment is effective, and connecting to available resources. Partial hospitalization is also known as PHP. These programs do include physician and nursing services, as well as group, individual, family, or multifamily group psychotherapy and other services. These programs are often used in lieu of an inpatient stay or as a transition from an inpatient stay. Typically, when you're discharged, you may step down to a lower level program. Outpatient detoxification monitors the withdrawal from alcohol or another substance of abuse. They can administer medications that assist with the detoxification and recovery from the addiction. Intensive outpatient treatment is also known as IOP programs. This may include group, individual, family, or multifamily group psychotherapy and other services. Able2, some health and life events can be overwhelming. Perhaps you received a new medical diagnosis such as diabetes, respiratory problems, or other health conditions, or treating as a caretaker. The Able2 program can help you work through these emotions, understand and stick with the treatment, and meet with a therapist and behavioral health coach for an 8-week program. This is done through video conferencing or by phone. So let's take a look at the inpatient services. All inpatient services do require prior authorization by calling Aetna Behavioral Health at 877-398-5816. Please press option 2 for behavioral health services. These services include mental health hospital admissions, substance abuse hospital admissions, residential treatment, and inpatient detoxification. Authorized in-network inpatient services, members do have a 20% coinsurance after meeting your deductible. Out-of-network behavioral health benefits are covered, but they are at a reduced benefit. The preferred PPO plan and Premier Copay plan will cover all services at 40% after the deductible is satisfied. The $4,000, $8,000 plan will cover all services at 50% after the deductible has been satisfied. Note that the EAP and the Able2 benefits are not available as an out-of-network option. All deductions and out-of-pocket maximum amounts are combined with your Blue Cross Blue Shield medical plan benefits. For further details on coverage, limitations, or exclusions, please contact Aetna Behavioral Health or refer to ICUBA's Medical, Behavioral Health, and Prescription Drug Plan document. Thank you.
Next, let's review your spending account options.
Hello, my name is Charlie with Discovery Benefits, a WEX company, and we administer your healthcare flexible spending accounts and your dependent care flexible spending accounts. These are great benefits offered by your employer that give you more control over your healthcare spending. And it's our hope that we can make it really easy to use these accounts so that you can pay for your expenses and you can move on with your lives. Your employer offers 2 accounts, which I'll go over in detail. But before I jump in, I want to note that both of these healthcare flexible spending accounts, as well as the dependent care accounts, they require you to make an active election every year. And so during open enrollment, you will let your employer know that you'd like to participate and how much you'd like to set aside from your paycheck to fund these accounts. But what's great is that whatever you set aside from your paycheck is deducted before taxes. And that lowers your taxable income, that increases your take-home pay, so your paycheck's a little bit bigger. And then you have this pool of money set aside to pay for your medical or your dependent care expenses. That's what makes these plans really great, and so we hope you take advantage of them and take more control over your healthcare spending. So let's start with the healthcare flexible spending account. This is like a bank account that you can use to pay for your out-of-pocket medical expenses, both for you as well as for your eligible dependents. You can set aside up to $2,750 to pay for these out-of-pocket expenses, and whatever amount you elect will be deducted from your paycheck evenly over the course of the year. And we give you a debit card that's loaded with your funds so that you can pay for these out-of-pocket expenses. Most of the time, you'll swipe your debit card and you're good to go, but there will be times when we ask for more documentation to make sure what you spent is meeting the IRS requirements for eligibility. Don't worry, it's really easy. We will let you know what we need and why we need it and how to get it to us. But what's really great about the healthcare flexible spending accounts is that whatever you elect up to that $2,750 can be used right away on day one. So if you elect the full $2,750, you can use that $2,750 right away on April 1st. So if you have a large medical expense early in the year, you can swipe your card or you can file a claim up to whatever you elect. You don't have to wait for those deductions to be made in order to use those funds. So even if you haven't made all your payroll deductions, again, you can use the full amount of your election right away on day one. But I will note as well that if the year goes by and you do not use your funds, then whatever is left over in your account will be lost. So as you determine if you want to participate in this plan, think ahead. Determine how much you think you'll need for your out-of-pocket medical expenses, because once you make that election, you cannot change it unless you experience a qualifying event. So let's switch gears to the dependent care flexible spending account, which is very similar in that you have money set aside from your paycheck before taxes, and if you do not use these funds, you lose them as well. But there are some differences. First, these accounts are meant to give you pre-tax money to help offset the costs of daycare, aftercare, gap camps, and the like. And to be eligible for these accounts, you must be working, you must be actively looking for work, or you must be a student. And if you're married, your spouse must be working, actively looking for work, or a student. But if that's all good, then your dependents are under the age of 13, then you can set aside these funds before taxes to help offset the cost of your daycare expenses. The IRS allows you to set aside up to $5,000 per plan year for your household to be taken out to offset these costs, and whatever you decide to elect will be taken out of your paychecks evenly over the course of the year. Now here's where you'll see another main difference from the healthcare flexible spending accounts. With these dependent care accounts, you can only be reimbursed up to what you've deducted from your paycheck. In other words, the full election is not available on day one as it is with your healthcare flexible spending account. What you do is you have payroll deductions that come to us, and then you would ask for reimbursements, and we will reimburse for eligible expenses up to what you've deducted from your paycheck. So you pay your daycare provider, you let us know, and then we will reimburse you. But we've got a great feature called automatic dependent care. And this is a form you complete once per year, letting us know who your daycare provider is and how much they charge. And then every time you have a payroll deduction that's sent to us, we in turn send that back to you as a claim and as a reimbursement. And so you don't have to do any work other than fill out this form once in the year. And then from there, you'll receive either a check in the mail or a direct deposit to your bank account for your dependent care expenses. I use this personally, and I made it really easy. We would pay our daycare provider, and then every 2 weeks, I would get my reimbursement directly deposited into my bank account. And so I highly recommend checking that out. Go to discoverybenefits.com. You'll find more detail on that form, as well as both your medical healthcare spending accounts, as well as the dependent care. These are great accounts, again, that lower your taxable income, they increase your take-home pay, and it gives you these pools of funds that you can use to pay for your out-of-pocket expenses. So we hope you take part, but if you have questions, let us know, and we'd be glad to help.
Your Employee Assistance Program is provided by Aetna Resources for Living. It is a free benefit for all employees, regardless if you're enrolled in your group medical plan. This benefit also includes anyone living in your household, as well as dependents outside of your household up to the age 26. You're eligible for a variety of resources, which includes up to 6 counseling sessions per issue, work-life services, and financial services, and much more. Let's take a look at the next slide to watch a short video of your EAP benefits. For more information, please call Aetna Resources for Living at 1-877-398-5816. Press option 1 for Employee Assistance Program. Thank you.
Did you know you have access to support designed to make your life simpler and better? Resources for Living is here to help you with just about anything, anytime. We're here for you 24 hours a day, any day of the year. And best of all, services are free for you and your family to use. Some days feel less sunny than others. That's why you can call us whenever you want a little emotional support with whatever's on your mind. We'll listen and try to help right then and there. And if you like, we'll refer you to a counselor where you can choose to talk in person, over the phone, or by video conference on your personal computer, tablet, or smartphone. If you have any cracks in your time management, Resources for Living can help. Simply call us for referrals to child and elder care providers, convenience services such as home cleaning and lawn care, support groups, pet care, and more. Or maybe you can use some help saving up for your next vacation. Resources for Living can help you with your finances through budget spending, managing your debt, tax planning, and more. And be sure to check out your discount programs to help your money work for you. The Discount Center offers deals on travel, entertainment, event tickets, and more. Has your paperwork ever gotten away from you? Legal services can help with cleaning up your credit reports after an identity theft, buying a fixer-upper, mediating custody disputes, estate planning, and more. You've also got access to online and mobile tools. Use Talkspace to connect with a dedicated therapist through text, video, or voice messages, anytime, anywhere. My Strength is an online mobile suite. It's like a support beam you can lean on to keep your mind, body, and spirit at their best. You can access guided programs to help you with managing stress and anxiety, substance misuse, sleep, pregnancy, and more. You can also track your mood or just find motivation from the daily inspiration. And you can access your member website for live webinars, articles, assessments, and resources to help you find healthy ways to overcome life's challenges. There's even a mobile app so you can grow on the go. With Resources for Living, you're always connected to helpful people and resources. We're here for you because you matter.
ICUBA's medical plan also includes several extras that you might not be aware of. These are benefits that are included in the cost of your medical premium. Let's check them out. Teladoc is such a convenient benefit, especially if you don't want to leave your house for care. Have you registered for Teladoc yet? It's super simple. When can you use Teladoc? You can use it when you need care now, if you're considering going to the ER or urgent care for a non-emergent issue, if you're on vacation or away from your house, or if you need a short-term prescription refill. Teladoc does not replace the relationship that you have with your primary care provider, but does provide a convenient, affordable option for quality care. So you can get the care that you need. Teladoc doctors can treat minor medical conditions including cold and flu, allergies, bronchitis, UTIs, respiratory infections, sinus problems, and much more for only a $5 copay. There are several doctor requirements in place to make sure that you're protected and you're meeting with a qualified physician. The Teladoc doctors are practicing primary care physicians, pediatricians, and family medicine physicians, averaging about 15 years of experience. They're all board certified and meet the ICUBA standards. With ICUBA's partnership with SurgeryPlus, they bring to us their elite Surgeons of Excellence network. With the Surgeons of Excellence network, we gain access to licensed, board-certified, fellowship-trained, screened for malpractice and sanctions, really great surgeons that are fully equipped to handle your surgical needs. Covered procedures through SurgeryPlus are going to be those non-emergent but medically necessary surgeries. So if you have something that you're able to plan out, it's summertime, I have time to take off from work, and I'd like to get a knee replacement, for instance. Any of these surgical procedures that are listed in the bottom left-hand corner of the screen. Knees, hip, shoulder, any of these non-emergent surgeries are perfect opportunities to contact SurgeryPlus. There is a financial incentive for choosing SurgeryPlus. For instance, your deductible and your coinsurance are waived if you choose to get your surgery through the the SurgeryPlus Surgeons of Excellence Network. With this also, your procedure is at no cost to you, and if travel is required, travel benefits are also included. With SurgeryPlus, they provide a full concierge customer service network for you, so you can contact a care advocate. What that care advocate will do, it will follow you along your continuation of care with the SurgeryPlus and your surgical procedure. They will help you locate the best provider to fit your needs. They will schedule appointments and record transfers and just help you through the full process. Everybody's favorite benefit, I'm sure that everybody on watching this video can attest to Rally being your number one with ICUBA. With Rally, we have a few incentives that are increasing and changing this year, so we just wanted to go out over the 2021-2022 Rally incentives with you. Starting off with the Rally Virtual City Challenges and on-campus events. So virtual challenges are back. This is going to be an incentivized item in the coming year for $5 per quarter each time a challenge milestone is achieved, up to $20 per year. So get in there, get registering for those challenge milestones, and there's also a continued chance to win a $50 Amazon gift card. So there's no rules or regulations around how many times you can win that $50 Amazon gift card, and those are given away every 14 days. So get in there, sync your devices, and get moving. With the on-site campus events, those are increasing this year to up to 10 on-site events. So watch from your benefits department on-site or on campus for those campus events. That information will be coming to you, and those events will be offered throughout the year. So up to 10 events totaling $100. The next is the biometric screenings and the annual wellness exam. And I really like to pair these into one bucket, totaling $100. I go to my annual wellness exam where my doctor does my annual blood work. And at that same point in time, I can print out the physician results form and have my doctor complete the form while he's reviewing my blood work with me. Super quick, super easy, and 2 birds with 1 stone. Also, we have added a few coin features. Previously, we offered Teladoc registration and tobacco attestation, so those are unchanged. But new this year, you can earn coins for getting your flu shot, an eye exam, or a dental exam. A brand new feature this year, which we'll review more in the coming slides, is My Health Novel. So this is a way to get you engaged within various programs that fit your needs, and we'll talk about that a little bit more coming up. But each employee and covered spouse has the ability to earn up to $330 this year. So we want you to keep moving with the Rally Virtual City Challenges, and this is what I was talking about, the incentive being added for $5 per quarter. That Amazon gift card is still going to continue for $14 or every 14 days. A $50 Amazon gift card is drawn at random from Rally. So if you're in there, you're syncing your device and you're joining those challenges, meeting those milestones, you're entered every 14 days for that Amazon gift card. Coming soon, we're really excited, and you guys have asked a lot for private city challenges. So new this year, ICUBA will be hosting private city challenges, 1 per quarter, and these will be ICUBA-wide challenges, so you can have the opportunity to compete not against everybody on Rally, but only against those other ICUBA participants. So we're really excited about this, and there will be a lot more information coming about these private city challenges in the weeks and months to come. So just to give you a little sneak peek on how you can join these city challenges, under the activities in the app, you can click on activities and then the exercise button. And then from there, you will select group challenges. And then you can choose which city challenge you'd like to join. This shows the DC dash. You would just click join. They're done by a certain number of days, and it'll show the amount of completion that you still have the opportunity to get those milestones in. So we also want you to know your numbers with your physician results form. So this is tied back to the biometric form. So step 1, employees and spouses enrolled in the ICUBA medical plan can visit your individual portal at the My Quest for Health, and you can download the physician results form. If you've never registered before, you can use the registration key ICUBA, and the unique ID is your Blue Cross Blue Shield ID number. The next step with the physician results form, each physician results form contains a barcode that's specific to the employee or spouse. So this cannot be shared, it is unique to you. So each employee and spouse need to set up their own account with myquestforhealth.com and download that form. A pro tip, if you have an established relationship with your physician, you can request your blood work ahead of time. That's what I do. I call my doctor's office when my annual visit is scheduled. I ask for them to call in the blood work in advance. I go to Quest and I get my blood work completed. And then all of the same visit, my doctor is able to review the blood work with me and complete that form all at the same time. Some items to keep in mind, the screening will include cholesterol, HDL, LDL, triglycerides, blood sugar, blood pressure, and A1C. So you need to also make sure that you're fasting when you get your blood work done. Remember to take the form with you to your annual physical. It's important both you and your physician sign the form, and then your doctor's office can fax it in with the number that's listed right on the form. You're encouraged also to request a copy for your own records, and if necessary, you can also upload it to the Quest portal in your own Quest portal. Members should allow at least 30 days for the form to be uploaded and faxed to see the results, and the final deadline for submission to Quest is at the end of the year, no later than March 31st. We also want you to stay informed with clinical rewards. If you've been diagnosed with one of these chronic conditions shown here, you're eligible for clinical rewards in Rally. What this means is you are provided quarterly and annual goals and just educational material related to your chronic condition. So you will have a tracker feature within the Rally system to help you keep track of how many points you've earned and various goals throughout the year, your activities, and ultimately the goal is for you to stay engaged with your chronic condition, meet the quarterly and annual items that they're putting out for you, and then 500 Rally coins are eligible to be earned each quarter and 2,000 Rally coins per year. The next newest and most exciting thing that we're rolling out this year is My Health Novel. So with My Health Novel, you must begin by taking a 1-minute assessment. Who doesn't have 1 minute, right? And from that, you will receive recommendations for programs and resources for which you qualify. Just for completing the assessment and this engagement, this will earn you that Rally incentive. When you qualify and sign up, you'll gain access to health coaching, nutrition guidance, digital tools, group support, and a lot more to help keep you on track. Whether you're interested in starting healthy new habits or maintaining your weight, My Health Novel matches you with the best nutrition and physical activity with weight management tools and programs, and there's also lots of apps available. So with My Health Novel, you're able to enjoy access to the programs and specialists who can help you answer questions and support you on your new health journey. This is all at no cost to you. It's simply by taking that initial assessment and just getting engaged in your healthcare. So the way that My Health Novel works is similar to Match.com. It takes in some data and preferences and will do some logic concoctions behind the scenes, and using pre-populated data from the last 12 months of biometrics, it does a look back period if you've gotten biometrics done in the prior 12 months, plus any self-reported data that you provide during that assessment, and also takes into considerations your member preferences. With all of this information, it drives the match logic to match you as an individual into the best suited program to meet your needs. There are no two matches that are the same, so this program is going to look unique for every person that completes the assessment, but there is a program out there for everyone. We're really excited about Hinge Health this year. This is a brand new offering this plan year for members struggling with chronic pain. This is an exercise therapy program that can help you conquer chronic back, knee, hip, or shoulder pain. from the convenience from your own home. It provides unlimited one-on-one health coaching with personalized exercise therapy, and even provides some electronic devices to help you stay on top of your activities in conjunction with your coach and the Hinge Health team. To learn more, please visit hingehealth.com/ICUBA. We'll also be rolling out a lot more communications and materials about Hinge Health in the coming months.
As part of your Aetna Behavioral Health benefits, we have teamed up with Able2, a leading behavioral health care provider, to offer convenient programs for members 18 years and older that are enrolled under the Aetna Behavioral Health. Some health and life events can be very overwhelming, like receiving a new medical diagnosis such as diabetes, respiratory problems, or other health issues. You may feel emotions like worry, depression, confusion, and even anger. But all of these feelings are normal, but they can make it harder for you to take control and make healthy changes. It is important that you control the health condition or life change instead of it controlling you. The Able2 program can help you work through these emotions, understand and stick with a treatment plan, know the types of changes that you need to make, and feel like that you are in control of your health and your life. You'll meet with a therapist and a behavioral health coach using online video, or you can simply talk on the phone if you prefer. This removes the hassle of driving and flexibility of a time that works best for you during the day, evening, or on the weekend. Meet once a week with a therapist to address the emotional challenges like depression, stress, and anxiety that come with a medical diagnosis, and also meet once a week with a behavior coach to identify health goals and develop an action plan. That's 2 sessions a week, including a final meeting with your therapist at no cost to you. For more information or to request Able2 services, please contact Aetna Behavioral Health at 1-877-398-5816. Thank you.
Next, we'll review some voluntary benefits available through your institution.
Greetings. Your institution provides income protection benefits through Symetra. These benefits are designed to protect you and your loved ones in a time of loss. Age restrictions and enrollment limitations may apply. Please remember that open enrollment is also a great time to make sure that your beneficiary information is up to date and accurate.
A brand new benefit offering is the Employee Paid Short-Term Disability. This Employee Paid Short-Term Disability benefit provides you income protection in the amount of 67% of weekly covered earnings to a maximum benefit of $1,000 per week. There's an elimination period for this coverage with 7 consecutive days for accident or sickness. The maximum benefit duration is 26 weeks. Rates are based on your age and also have to do with your benefit amount or income. And these benefits are guarantee issue for the 4/1/21 plan year, which means that you can elect this benefit with no medical questions asked. Also new this year, we're offering Employee Paid Long-Term Disability. The Employee Paid Long-Term Disability benefit offers income protection in the amount of 60% of your monthly covered payroll earnings to a maximum benefit of $8,000 per month. The elimination period for this coverage is 180 days and will follow the short-term disability offering. Rates are based on age as well as your income bracket, and guarantee issue as well for 4/1/21, which means you can also elect this benefit with no medical questions asked.
You may have the opportunity to increase your life or disability coverage during open enrollment. And if evidence of insurability is required, you will receive a notice indicating action required. If you receive that notice, please follow the instructions and remember that the EOI connection to Symetra will occur after you've completed your enrollment. The EOI process must be completed and coverage will need to be approved by Symetra before your coverage is active. Please make sure to answer all questions to the best of your ability, and Symetra will contact you for any missing information. When is evidence of insurability required? EOI is generally required when employees apply for group life coverage amount that exceeds the guaranteed issue amount, want to increase their current group life insurance amount, enroll in group life coverage after declining it during the initial eligibility period, or decide to add disability benefits to their list of coverages. Symetra policies also include a few value-add services which are available to you and your eligible dependents. This includes travel assistance provided by Europe Assistance. When emergencies happen far from home, it's comforting to know there's a team of multilingual professionals standing by to help you. Your travel assistance program offers a variety of 24-hour-a-day services in more than 200 countries and territories worldwide, each being just a phone call away. You'll find some of the highlights of this program on this particular slide. Now let's talk about identity theft protection, which is provided by Generali Global Assistance. Identity theft is a rising concern for all and certainly can happen to anybody. The Identity Theft Program provides you with information to protect yourself and step-by-step coaching to help you confirm and resolve identity theft. You'll find some of the highlights of this program also included in this slide. The last value-add service is our beneficiary companion provided by Generali Global Assistance. Managing a loved one's spinal affairs can be incredibly overwhelming. Your beneficiary companion program can offer some relief and provide guidance to help with paperwork and other time-consuming activities. You'll find some of the details of this program also included in this slide.
Nationwide pet insurance is also on the forefront. Through the partnership with ICUBA, all employees are now eligible for the preferred pet insurance pricing with Nationwide. With this, you receive discounts, very large discounts from the standard Nationwide pet insurance, and employees have the option to choose on a direct bill basis. So this will not be payroll deducted, it'll be a direct bill through Nationwide, but a level of coverage that fits your needs, ranging from 50 to 90% reimbursement on vet bills that you're already racking up. So you can save with the preferred ICUBA pricing using any vet anywhere, and you can get cash back on your vet bills. This is a fast, no obligation quote. You can visit this website. It is also in your enrollment flow if you'd like to learn more about this. You can also research other animals besides cats and dogs by calling Nationwide directly at the number listed on the screen. And then again, it is also available in the portal as well. AFLAC benefits are another key component of the voluntary benefit offerings from ICUBA. With the AFLAC critical illness, this includes coverages for those critical items that you might encounter, including cancer, heart attack, sudden cardiac arrest, coronary artery bypass, major organ transplant, bone marrow transplant, kidney failure, and stroke. These critical illness benefits will pay a lump sum cash benefit to you. It pays in addition to other insurance, and there's guarantee issue again this year up to $30,000 for employees and up to $15,000 for spouses. Keep in mind, spouses are only eligible to elect up to 50% of what the employee sets aside for coverage for yourself. Children up to the age of 26 are automatically covered by the employee's election, and this is also portable if you should change jobs or retire. With the critical illness, we hope that none of our members encounter a critical illness in the upcoming plan year, but keep in mind with this benefit that there is a bonus benefit of a $50 annual wellness or health screening benefit. There is also a pre-existing condition clause for cancer in the prior 6 months, and you do have to be treatment-free for 12 full months if you've been diagnosed with cancer. You can still elect this policy if you currently have cancer or have experienced cancer in the prior 12 months. It will just not cover that specific cancer diagnosis. AFLAC Hospital Indemnity is also available. This includes hospital admission or confinement due to an accident or illness, including maternity. It pays a lump sum cash benefit to you and pays in addition to other insurance. This is also portable if you are changing jobs or retiring, and this benefit is available with no medical questions asked. It is available in 2 levels of coverage. We have a low plan and a high plan. The high plan covers admissions up to $1,000 and the low plan covers admissions up to $500. The confinement and the intensive care on both high and low are equal. So there's an example here shown for pregnancy or delivery, just with that different admission benefit of $1,000 or $500 with confinement of up to 3 days, and you can see the difference in the total that's paid to you. If you are like most people, you don't budget for life's unexpected moments. None of us are hoping to have an accident, but this accident plan can be there in your time of need for unplanned expenses, including ambulance rides, emergency room visits, trip to the urgent care, bone fractures, burns, lacerations, and a lot more. We hope also that you do not experience any accidents this year, but this benefit also does come with a bonus of that $50 annual health and wellness benefit as well. So these are your AFLAC benefits, and if you have any questions, there are brochures available in the portal for you if you'd like to learn more. You might be curious, how do you file a claim with AFLAC? To file a claim online, you can visit aflacgroupinsurance.com. You'll select customer service and then file a claim. Please note, specific documentation such as itemized bills is required when submitting claims to AFLAC. Specifics for your claim are listed in the website. I just wanted to thank you so much for your attention during this presentation. I know that it was a lot to cover and we covered a lot of material. We really hope that you found this presentation informative, and we really look forward to a successful upcoming plan year with better benefits through collaboration. If you have any questions, please contact your HR department or let us know. We're happy to help. Have a great day. Bye.